Today I'm going to be doing medication administration. So prior to going into my patient's room, I'm going to go ahead and look over my MAR and make sure all my orders are complete, and if any incomplete orders, I would go ahead and notify the provider. I would also verify any contraindications for this patient's medication, and I would verify that the patient knows why they're taking this medication as well, and do a further assessment when I go in the patient's room. Good evening, my name is Alyssa and I am going to be your student nurse today. Hi Annie. Yes, I'm going to go ahead and take a look at your wristband. I see your name is Annie Nelson. Can you tell me your date of birth? 1/12/92? That's great. So I went ahead and looked in your chart and I see that you don't have any allergies. And I see this on your bracelet as well. She doesn't have any alerts. So today I'm going to be giving you your PO medication, that means by mouth, and I'm going to do a physical assessment on your swallowing to make sure you can swallow whole pills okay. Great, okay, and you take pills whole usually? Okay. And what would you prefer to drink with your medication? Water or juice? Water? Okay, good. I'll go ahead and bring some water in for you. And do you know why you're taking this medication? Yes, you do? Okay, great. And so what I'm going to do is I'm going to go ahead and prepare your medication outside this room, and I will be right back. Do you have any questions for me? No? Okay, great. And also with this medication, I would have done any assessment as well, but this medication doesn't need any physical assessments, so no vital signs, no labs, no pain examination, but in general I would do those things at this time when I was in the patient's room, such as take an apical pulse for any contraindications with this med. Okay, Annie, I will be right back. Thank you. So here is my med cart, and normally I would clean off the cart, and I would go ahead and first I would again do a check against my MAR, do my first check for my patient medication rights, which is right patient, right medication, right dose, right route and right time, and lastly right documentation. And so once I do that, I would then wash my hands to make sure my hands were clean prior to preparing the medications. I have my tray, I have my cup, and I have my medications. So my second check would be I'm comparing the medication as I'm preparing it. So that would be my second check. And I see that this order calls for Tic Tacs 200 milligrams POQD, and in fact these are Tic Tacs 100 milligrams, so patient will get 2 tablets. I go ahead and I look at the expiration. The expiration is good. The pills are fully in stock, so I don't need to restock after because there's more than enough. I would go ahead and pour my 2 pills in here. Wait, there's 2 pills. And then I would pour water in my cup, and I'd set it on my tray. It makes it easier to carry into the room, and I would also bring this to compare my third check with me once I got into the room. And if I was doing pills, I would go ahead like I just did and put it in the cup. If I was doing liquid, I would pour it at eye level and make sure it's by with the meniscus. And then if it was buccal, I would instruct the patient to put it in between the cheek and the gum. If it was sublingual, I would say put it under the tongue. If it was powdered, I would wait, or crushed, I would prepare the medication, but I wouldn't mix it in anything until I got in the room. And if it was a crushed med, I would only mix one medication in the applesauce, and then if there was another medication, I would mix it separately in another applesauce. Okay, I'm going to go ahead and enter the patient's room now. Hi Annie, I am back again. My name is Alyssa and I am your nurse, and I have my MAR with me. I have all my supplies. So today, again, I'm going to be giving you your medication, and do you take the pills yourself, or do you need my assistance? Okay, you need my assistance. So I'm going to go ahead and pull the privacy curtain, and I'm going to go to the sink over here and wash my hands. Great. Okay, and I'm going to go ahead and raise your bed to working height. It's important to put the patient in high Fowler's position so they don't have any trouble swallowing and avoid choking. So I've raised her up in her position. Are you comfortable? Great, Annie. I'm going to go ahead and do her patient identifiers again. Her name is Annie. I'm looking at her bracelet, and her date of birth is 1/12/92. No drug allergies. So I'm doing my third check at the bedside. Again, Annie, you're going to be taking a Tic Tac 200 milligrams. I'm going to explain what the patient's taking this medication for, and then I'm going to go ahead and give it. Annie said she wanted me to help her, so I would normally have a bedside table. I would set that down. Here you go, Annie. Okay, great. And here's your water. Okay, and did you swallow that okay? Great, okay. Do you have any questions for me? Okay, thank you. And so I'm going to go ahead and check back on you in 30 minutes to an hour. I'm going to put the patient's bed back down to the position it was in, lower the bed, and I'm going to put her back into a comfortable position that suits her. And then I'm also going to give the patient their call light. Annie, I'll be back in 30 minutes to an hour, like I said, but if you need me before then, you can just hit your call light and I will come. After that, I would discard my cup, my medication cup. I would wash my hands again. I would open up the privacy curtain if the patient wants me to, and I would then go out, make sure I document right away, and then also document any outcomes from the medication and any outcomes of the medication and, side effects if the patient experienced any. And that would be my medication administration. Thank you.